For some, the first step to exiting homelessness is transitioning into a shelter, but in the past, this meant hours and hours a day simply waiting.
Being in this field for so long, it used to grieve me to see that people would spend their whole day in lines. They'd be in line for breakfast, in line for lunch, in line for dinner, in line to get into shelter. We used to do things in ways that were not helpful to people, but we have changed a lot.
One major change for these shelters was the shift to a 24/7 model of access for the guests. Denver worked with partners to accelerate this transition during the pandemic.
Well, the city is primarily a funder and also has helped with bringing in personnel to fill in gaps, but it's really the work of our partners. Like here I'm standing at Denver Rescue Mission, and they stepped up alongside many other shelter and service providers to pivot quickly and realize our 3-year shelter plan. Our plan called for residential shelter, 24/7 places for people to be. 24/7 shelter really helped to provide a more stabilizing space where people had access to an assignable bed, where they knew they would have a place without having to stand in line. And it had secure storage for belongings, a place where they could know that their belongings would be safe and in their control.
The shelter's cool. It's cool. Helps me rest, take a shower, eat, and so I can be ready for work the next day.
And what I tell my staff is one of our goals is to make it to where the people sleeping in our shelters can sleep with both eyes closed. You know, we're trained in de-escalation skills and conflict resolution, not aggravate their condition, but to help them. You know, they have a good place to sleep, they have a good place to keep their belongings, they have good showers and restrooms, and our food is excellent. And we do keep an eye on keeping things safe from coronavirus.
In addition to the amenities and food, guests have access to wraparound services like health and dental care, as well as case managers to help connect them to services, employment, and permanent housing. The shift to this shelter model was followed by a noticeable increase in shelter usage.
About 16% of the people who were at the National Western Center complex said that they had previously been sleeping rough. So we actually saw a lot of people come inside who had previously been sleeping outside because now they had this place to be around the clock, a more stabilizing space, and a place where they felt less anxious and better rested. And it's not really surprising that when people feel that they have safety, they have the stability of knowing where they're going to sleep at night, they have good meals, they do better. They're ready to engage in case management and help move towards those longer-term housing solutions.
For more stories, check out Denver's YouTube page or tune in to denver8.tv.